Welcome back, viewers. Welcome back. Thank you so much for tuning in. My name is Tawia Patrick Matope, and on this channel, I talk about social work, mostly child protection or safeguarding, because that's what I do. And that's what I've been doing for many years now, since I left college. In today's video, I'm going to be talking about the impact of budget cuts and government, central government policies on child protection in England. Really, it's more of a policy issue, and I hope the few points which I'm going to be sharing with you today are going to resonate with some of the things which you might be seeing in your local area or you might be seeing in your workplace. Basically, I'm going to touch on four things. And then also touch a little bit of on how those things can actually be addressed. Before I get right into it, for those who are new to the channel, please do subscribe, hit that notification bell so that when I post, you'll be the first person to know. And I just want to put a disclaimer as well to say I don't, consider myself to be a guru in social work, but the information which I share here, it's more from my own experiences of being a social worker for more than 18 years, and also from my own self-directed learning. So it's just the quest for me to share information which I know, and I hope it will help somebody out there. And if it invokes some kind of sentiments or some discussions that you that you may want to kickstart, please do put your comments in the comment section below, and just try to be nice in the comment section, because it's on the public, and everybody else has got access to it. So thank you so much for joining. So like I said earlier on, today I'm going to be talking about the impact of budget cuts and central government policies on child protection in England. What are the emerging themes? I'm going to talk about four emerging themes from my own understanding and from my own experiences with being in child protection for so long, really. The first one of the emerging themes is the reduction in early help intervention services. Why am I saying so? Because whenever the central government talks about budget cuts, the first port of call that local authority does would be to cut early help intervention services, because they are non-statutory. They are early help, they're just early help intervention services which are offered, by most local authorities. Because they are non-statutory, whenever there are budget cuts, local authorities tend to divert from that and focus more on statutory interventions, so that they manage with the fewer resources which will be at their disposal. So when you talk about funding cuts, from my reading, I think from what I've read so far, and from my own understanding as well, since I've been practicing, I would say since 2010, funding for children's services has fallen significantly, and with almost about 23 to 25% reduction, especially from year 2010, 2011 up until 2018 and 2019. So that's quite significant if you look at it, really. If you've got 25% reduction, the impact it has on local authorities is, whereas you are given a budget, say for example, of 10 million to spend per annum, if that's cut by 25%, you can actually do the math and see where that leaves most local authorities. And when it comes to crunching the numbers and actually making decisions, early help intervention services do suffer, and they will be the first ones to be cut. If you look in most local authorities or in most local areas that where you live, children's centers have closed. Local parks or whatever that you can think about, which were services, or youth centers which were there, they have closed. That is a direct impact of these funding cuts which are actually in place. So this leads to a substantial decrease in spending on early help intervention services, like I've said already, which has been dropped. So I'm saying since 2010, we are talking of a reduction in funding of more than 25%. So that's quite a lot. So it means, when it comes to cuts, the local authorities will start to look at, okay, what is it that we are doing as an additional service to the local community that we can cut? And then cuts will be coming, to those kind of services. If you remember, there were play centers, there were many centers which were child focused, really, which have actually since closed because of, funding cuts. And the other point within, reduction of early help intervention services, if you look at it, is also service closures. Many children centers have closed, like I said, which were providing, crucial key early intervention services, where, sometimes health visitors were based, and sometimes the family support workers were offering support to families, especially new fathers, new mothers, and so forth. Their closures, was mostly due to budget cuts, and this has reduced the availability of, support to families and children, particularly in those most deprived areas, in England, really. Right. Moving on to key theme number 2. It's increased demand for late intervention. So what do I mean by increased demand for late intervention? When there is cuts to early help intervention, it means there is no that buffer which offers support to our communities. So when a case then is referred to children's services, it's actually referred at a later stage when things are already out of hand. What happens when that, what exactly happens when that happens is that there will be increased demand for late intervention. What do I mean by that? There's a shift in spending, like I said earlier on, with reduced funding for early help intervention services. Local authorities then have to focus on late intervention services. It includes child protection teams. It includes, youth workers. It actually includes youth offending services, because those are now statutory services that needs to be offered. When a child is placed on a child protection plan, that's statutory. When a child is placed on a youth, referral, order, that's statutory. Then, there is an increased, demand for those services, because things are left until things are late for children's services to actually intervene. That's how it impacts, on communities, really. So that increase is increased by, remember I spoke about funding is, reduced by 25%. The increase on late intervention services, intervention statutory services has increased by more than 30% since 2010. That's the impact it has. So whereas you have got a decreased, funding of early help intervention services, you've got an increased funding of late intervention statutory services. That's how it impacts. Right. Moving on then to key theme number 3 is when there is budget cuts, or directive from central government, for budget cuts and so forth, or when there is decreased funding for services or budget cuts, like I said earlier on, there is inequalities in service provision. What do I mean by that? When you talk of the whole of England, obviously we know that there are some parts of England which are most deprived as compared to others. But when budget cuts come, they don't only affect areas which are affluent, but it also affects areas which are also deprived. So when those cuts come, if you can imagine an area which was already deprived, then it's impacted by budget cuts. The impact is even worse off as compared to an area which is affluent, who can actually subsidize those services from public other means of funding which they can actually put in place. So there will be what we call geographical disparities that will be in place, which is sort of like, the north-south divide is, if you read many, articles online, or if you watch news, you'll hear about the north-south divide, in the scale of, funding cuts and reductions in local authority spending. What it basically means is some of the most deprived areas are on the north of England, and if you look at it mostly in the north or the northeast, it has seen the largest reductions, followed by areas like London, Yorkshire, and sometimes the Humberside as well. What did this do to those local authorities? It has led to increased disparities in those local authorities, especially to the availability and the quality of support services which are in place. You can talk about whether it's statutory or non-statutory, but the quality of those services is heavily compromised when that happens, especially when you look at different regions and so forth. And like I mentioned earlier on, the impact of all this on the most deprived areas is actually quite significant if you look at it, because if you are talking about an area which has already been deprived and then it's hit by those budget cuts, They have no other way of augmenting or sub, or there's no other way of they can find additional funding to start to fund those services. Whereas if it's affluent areas, you can find one donor who can say, okay, fine, I can actually fund this for the whole of for the whole of next year or for the next 2 years, so forth, which is not always the case in deprived areas, really. So some of those most deprived areas, really, if you talk of areas like Middlesbrough, Leeds and so forth, they've actually seen a reduction in in usage of some of the services, which are actually key in making sure that children are protected and are actually safeguarded. If you look at it, which actually exacerbates the inequalities which are already or which are already there in those areas. What does it do? It leads to poor outcomes for children. That's the direct impact that we can talk about. It leads to poor outcomes for those children in those particular areas, really. And then theme number 4, which is the last of the things which I'm going to be talking about under this topic, because I'm trying to make this video as short as possible and for you, the viewer, to be able to watch up until the end, is challenges in workforce capacity and retention. Challenges in workforce capacity and retention. I've spoken about this in the last video. The challenge is that obviously when there is cuts, it means where a local authority would have employed, say, 10 social workers in a team, they won't be able to employ 10. They may employ 6 or they may employ 7. What does it do? It means higher caseloads. When it means higher caseloads, it means social workers and other child protection professionals, they are managing increasingly difficult and complex cases, with less resources, with reduced staffing levels, where there is also increased demand for those particular services. That's how it can impact you at your local level. And this can also significantly compromise the quality of care, the quality of services being delivered, and the attention of each and every service provider that they can give to each particular child. That's the impact it has on the local level. And then when you talk about the high caseloads, the other direct impact of that is staff retention, because obviously when there is high caseloads, you may not be able to retain staff. Staff will leave, and then you will have another challenge of training as well, because budget cuts are already in place. You won't be able to fully train staff members to the level that you would want because of budget cuts. For example, if you look at some local authorities, what was on offer on training 2-3 years ago is not exactly what's there. Sometimes local authorities may only have maybe a couple of trainings in a month, whereas 5 years ago there would be almost a training almost every week. That's not happening anymore in most local authorities because of budget cuts. So when there is no training, people are not being retrained. It means the quality of service which they are going to be delivering is also compromised. And the ability for local authorities to retain staff or experience the staff is also compromised. And then the impact it has on service delivery is unimaginable. So that's the last theme I'm going to be talking about. So switching on the other side of the coin, how do we address some of these challenges? We need to advocate for increased funding. That's number 1. We need to advocate for increased funding. It's not only for us social workers to advocate for that, but you as a voter or you as a person living in your local area, if you have identified the shortfalls or if you identified the challenges which are there in terms of budget cuts and funding to these services, you need to be advocating with your local MP, advocate with people who are influential in your area to make sure that your voices are heard and so forth. So we need to be, advocating for increased funding for children's services, which needs to be an ongoing, call to the government and to whoever, especially to the central government, to make sure that we kind of address the estimated shortfall in terms of funding gap for children's services, which is estimated at between 3 to 5 billion pounds at this point in time, really, by year 2025. We're already in year 2025, as you can see. And then we also need to focus more on early intervention. You will find that I think one of the key pillars of the Labour government is to move back to early help intervention, making sure that services are offered in local hubs, in local areas, in local children centers, so that they're accessible, to local populations and so forth. That's one other way of reversing the tide, really, so to speak. So currently there is a push to restore and enhance early help intervention to prevent issues from escalating further, like I said earlier on, to reduce the long-term demand for late response intervention statutory services. And then we also need to be talking about equitable resource allocation. It doesn't necessarily mean that because an area has got 2 million people, you can give equal funding to an area which has got 2 million people, while it's in London, and another area with 2 million people which is outside London, which is possibly in an affluent area. You need to look at allocating resources specific to the needs of that particular area. That's one thing which obviously the government needs to be looking at, which can also help in terms of having arbitrary or universal budget cuts. You can look at apportioning resources to particular local authorities depending with the demand or depending with the level of complexity of cases coming out from that particular area. Whereas if you just make a blanket allocation to say, oh, because this local authority has got 200,000 people, then we can allocate the same funding with another area with also 200,000 people. Whereas there is, an issue around that being an affluent area who can actually pay more in council tax, whereas the other local authority may not be able to do that. So that's one other thing of also looking at it. That can also, help to address some of these disparities which are actually prevalent, which are available or which are, prevalent at the moment. And then obviously we need to support the workforce, make sure that people are the remuneration is commensurate with the job that they do, and this will do away with the issue of most local authorities being unable to retain staff. So we need to make sure that social workers are paid more. Yes, the money should come and so forth. Where there is the ability of the local authority to retain staff, it means that there is no shift or there is no change of social workers for that particular family. You will hear that some families may have had 6-7 social workers in a span of 2 years. That's quite possible. I've seen it, and I know it happens. So it's something that that can be curtailed if staff are well retained. If they are well paid, they will stay, and that they will be consistent in terms of service delivery, and you will be able to retain more experienced staff, which means you are also able to increase the quality of the services that you are offering. With those few nuggets, I hope I've answered one of the viewers who asked the impact of budget cuts and interference from central government in terms of funding and what is the impact of this. This video was just a short clip to explain the nitty-gritties of that. And if you have got something to comment, please put your comments in the comment section below. And thank you so much for tuning, and thank you so much for watching, and I hope this has helped. For those who haven't subscribed, please do subscribe, share, and hit that notification bell so that when I post, you'll be the first person to know. Thank you so much.